Nigeria has received 72 deluxe vehicles, 6 ambulances, and medical equipment to help improve the coordination and management of the federal government's HIV/AIDS, tuberculosis, and malaria programs. The equipment were purchased by the Global Fund as part of the Grant Cycle 6 investment in 2021 to 2023 implementation period. Mark Eddington, head of grant management at Global Fund, said the donations will be distributed across the 36 states in Nigeria.
We're delighted to have the opportunity to reaffirm the Global Fund's commitments to support the work carried out in the states and highlight the significant level of investments made to expand the diagnostic network for HIV and TB. Over $120 million worth of diagnostic equipment and related consumables have been purchased since 2022, and you just heard what those are from the previous speaker. The 72 vehicles that we'll see today were procured at a total cost of $2.8 million, specifically for use by the state programs. Each state will receive 2 vehicles, and they will be delivered to the states in the coming weeks. So what will these vehicles be used for? Conducting joint HIV/TB supervision activities in the health facilities. And I understand there are about 40,000 service delivery points and 774 LGAs. So a lot of ground to cover, that's why you need the vehicles. Work with the partners and the CBOs in the states to carry out pediatric HIV and childhood TB outreach in the nutritional clinics. Conduct targeted contact tracing and line listing in communities of surge casing.
The Coordinating Minister of Health and Social Welfare, Professor Mohammed Patti, who was represented by the Minister of State for Health, Dr. Tunji Alausa, said the donations would also help build a resilient and sustainable system for health in Nigeria.
Nigeria is one of the highest recipients of Global Fund investment and has signed about 4.8 billion grant from the Global Fund, including the Grant Cycle 7 that was signed recently to support the HIV, TB, and malaria programs, as well as building resilient and sustainable system for health since 2002. The Global Fund has been and has remained a strategic partner to the Federal Republic of Nigeria for over 2 decades. The current donation of 72 Toyota Hilux operational vehicles, which will be distributed equally across the 36 states of the Federation, including FCT, to support state government oversight of integrated HIV and tuberculosis programs in the respective states, which, as well all know by now, are a critical component to the response strategy. This is also a fitting step towards the devolution and decentralization of responsibilities, as well as shifting the ownership, coordination, and responsibility of the management of our national response from central government to the state and local government.
FHI 360, as a principal recipient with the sub-recipients, has been supporting the government in reducing the incidence of HIV infection, mortality and morbidity in Nigeria among general population, as well as intensifying interventions for key vulnerable populations. Without these kinds of serious long marathon invested donor funding partners, I think that the world would actually be not where we know it to be today. So on behalf of Lagosians, on behalf of His Excellency Mr. Babajide Sanwo-Olu, on behalf of Nigerians and really anybody around the world that is suffering from a disease that is potentially manageable, curable, and improving the welfare of themselves and their families, I want to thank the Global Fund and everything you do and everything you contribute to humanity.
We are celebrating because Nigeria has a leadership that is focused. The Federal Ministry of Health, under all our key stakeholders, are also focused. And we are tasked to work as people that can ensure that we have a task to deliver, and we are responsible for what we are receiving. We appreciate the Global Fund.
The medical equipment donated include 350 mobile digital X-ray machines, 100 TB lamp machines, mobile digital chest X-ray vans, 45 biological safety cabinets, and digital chest X-ray machines.